maintain it, so I got a good story with a patient. His name is Walt, and he's a great patient. Him and his wife have been coming in for years. And so they've been coming in for years, and then they moved, they got different jobs, and life hit them, and so they stopped coming in. And so he was coming in initially for low back pain, just some chronic issues that he was having. And so after we started adjusting him, the symptoms all subside, they go away. He's doing really well. And so they stopped coming in for about a year. And then they come back, and guess what's back? His pain, his problems, they're back again. And so now he's having this excruciating sciatic pain traveling down his right leg. And I mean, it's to the point where he couldn't lay down. He just, he just had to get on his side. He would move his hips around and, move his knee around. And he said it was just to the point of just excruciating pain. And it had been there 8 months.
Wow.
Before he came back to the office.
Maybe a little pride in there somewhere.
Yeah, so Walt, if you're listening, you waited too long. So, 8 months, that's a long time to let that go. And so he comes in, we get the first adjustment, that we had since he came back. And then he didn't jump off the table, but he was like, oh my God, like I feel better. And it wasn't like all his pain was gone or anything. But about 2-3 weeks in, all of a sudden he's like, Doc, it's completely gone. 2 or 3 weeks, he's had about 9 adjustments or so. He's like, this pain is gone. He's like, you don't understand how bad this pain was. And to be honest, I don't understand because I haven't had to experience something like that. But his wife was in there with him. She's like, Dr. Chris, you don't understand. Like he couldn't lay down. He was struggling, just moving around. He couldn't do anything. He wasn't himself, and he was grumpy, all these other things. And so, the point to that is you always have to maintain your health. You don't just go to I love this example because you don't just go to the gym, get the body you always wanted. This is where we talked about people that go up and down with their working out or their eating right or those kind of things. Because if you go up and down with your working out and your eating right, you're going to go up and down with your health. Your health is, your body, just from a vanity perspective, you're going to start to gain weight. You're not going to look the same if you stop working out. Because if I work out, if I get the body I've always wanted or the body that looks good to me, and if I stop working out because I made it, I got there, what's going to happen?
Yeah, it goes back.
It's going to go back, right? It's going to go back. And so the same thing, let's take a cancer patient or someone that's trying to fight cancer. I mean, if they fight cancer naturally and they don't do chemo radiation or something like that, and now they've lowered their tumors, they've got their blood counts up and everything is good, the tumor load is down, and they stop doing all the protocols that got them there, what's going to start to flourish back up again? The same cancers, the same problems, because your health is a journey. It is not a destination. It is never somewhere that you are just going to get to and be like, I made it. That's not going to be the case. It's going to be something that you constantly have to pour into. You're always going to need to pour into your health. And then you got to look at it as you're an example. If you've got kids, you are an example for your kids. If you're married, you're an example for them. The way you live your life, the way you love God, the way you love your church, the way you invest, the way you treat other people, and the way you take care of your health, your kids, your spouse, your family, your coworkers, people are going to see this. And you can teach people, you can educate people, and people can want to follow you because they see the level of health that you have, and they want to replicate that. Mm-hmm. And Dr. Rick, that's a big thing that I feel like for myself is creating a standard of health that I carry for myself, just so the patients that we have, they can hopefully carry some type of standard that's close to that, and then we can document what we do and try to get that processes to them, so they can do the same things. You just did a coffee enema this morning, so they can do coffee enemas, they can do sauning, they can, juice, they can smoothie, they can take the right supplements, all of these things that are part of your health. This doesn't happen overnight.
Right.
But once you start to make these lifestyle changes, oh my gosh, the sky is the limit to your health. The things that you never thought were possible will be possible again because you have an amazing healing power within you that God gave you. You've got to put some faith back in that tonight. You've got to put faith that your body can heal.